I'd like to call on Representative Stella Kimbo.
Salamat, Madam Chair. Before anything else, gusto ko po sanang linawin sa PhilHealth na kami po ay kaisa ninyo sa inyong layunin na mawala na ang fraud dito sa PhilHealth. So, pero unahan ko na po kayo, mabigat ang aking paniniwala na palagay ko hindi yung TSPC ang magiging paraan para mawala ang fraud. No, anyway, so ang first question ko po, in fact, it's an observation, Madam Chair, na matagal na pala itong TSPC. Yet, despite that, wala naman po tayong, may fraud pa rin, di ba? And that's the reason for why last year, ang Congress, pati ang Senado, ay nag-conduct ng investigations. So, halimbawa po sa COVID, alam ba natin, Madam Chair, nandito pa ba si Attorney Helen? Ilan po ba ang total COVID claims natin for inpatient care so far?
Good afternoon. Good afternoon, Madam Stella. Can we present our
total number lang po?
Apo, our
total
MMG
number.
Or HPC?
I think, Kong Stella, yan yung malaking issue ng hospitals natin. They were saying halos wala pang nababayaran, even the COVID tests, no? Kagabi lang, I was talking to a government hospital, DOH retained, and na-mention nila sa akin how huge the amount PhilHealth owed them. So parang ito ay hindi lang sa private issue, even in government hospitals. Quiet lang siguro sila. But Dr. Almora is also a representative of government hospital, being the president of PHA.
Tama po, so laking problema ng hindi nagbabayad. Pero isa pa rin problema yung potential na fraud, which I believe yan ang pinanghuhugutan ng PhilHealth. So kung tama po ba ang numbers ko na based on a DOH report, there are so far 129,000 claims, COVID claims, for inpatient care sa PhilHealth. Can you confirm that number, sir?
PhilHealth, Attorney Geran?
Madam Chair, can I refer it to the appropriate sector?
Go ahead, sir.
Yeah.
Who will respond, sir?
MMG or HPC?
If I may, Mr. Chair, Madam Chair.
Yes, go ahead,
po, no?
Yes.
Yes po, no? For 2020 po, yung aming COVID claims is around 308,560. And for 2021 po, it's around 673,162.
That's just for inpatient care?
Inpatient po, opo.
308 last year and then 600.
73,000 po, yes po.
But do you know, sir, that there are only 1.85 million COVID cases in total? So far, pag titingnan po natin ang total number of COVID cases, ayon sa data drop ng DOH, we're looking at 1.85 million COVID cases. So, ang sinasabi ninyo, halos kalahati po niyan, nag-claim for inpatient care. That's the implication, di po ba?
Yes po, yun po yung nasa database po namin.
Correct. Pero di ba ang assumption din ng DOH is only 5% would be severe and critical, meaning the 95% of COVID cases tend to be mild, in which case hindi kailangan ng inpatient care. So, nang sa ganon, I mean, if 1.85 million ang total and you apply 5%, ang ina-expect mo lang na severe and critical would only be 92,500. So if we're looking at a situation na 900,000 nga ang nag-claim mula sa PhilHealth, siguro ito na nga ang pinanghuhugutan ninyo. Tama ba?
Yes po, the data po includes po, kasama po dito yung mga testing claims
Ang
po.
sinasabi ko, hindi inpatient care yan. Kaya nga, palagay ko 129,000. Kasi kinuha ko naman yan sa DOH report. But gayon pa man, 129,000 exceeds 92,000, which is 5% of the 1.85 million COVID cases so far. So anyway, so palagay ko, because it would seem like mas maraming COVID claims than expected, baka doon kayo nanggagaling. Tama po? And which is why you want to strengthen your efforts to control fraud. Tama po?
That's correct po, Madam
Okay.
Congresswoman.
Pero ang problema sa tingin ko is palagi ko hindi yung ako, I'm all for improving due process, no? Tama po 'yan. That's really, we need to increase fairness, etc. Bigyan ng pagkakataon ang ating hospitals to comply, etc. Wala akong problema doon. Pero sa tingin ko, ang improving due process is not really going to directly result in a vast reduction in your fraud cases. Ang tingin ko dyan, it's really capacity. So sa ngayon po, do you have a fraud forensics unit within PhilHealth?
If I may po, can I refer it to Attorney Barbado po? He's the head po of the Fraud Investigation Division, Department po.
Attorney
So
Barbado.
meron.
Yes, Madam Chair. No? We have
And how many? Ilan pong employees po ang nasa unit ninyo?
we are 26, Madam Chair.
26. Alright.
But you know what?
Ilan po dyan ang abogado?
Sa ngayon po, 2 na ho kami.
2. Paano ninyo aasahan na meron kay 9,496 accredited hospitals at iniisip ninyo na baka maraming o talamak ang fraud, pero 2 lang po kayong pwede mag-prosecute? Paano niyo po mapapatupad itong TSPC? Hindi po ba problema ng capacity ang hinaharap ninyo more than the TSPC?
Madam Chair, we have legal offices in our regional office, regional
Okay,
office.
yun nga yung tanong ko. Sa pangkalahatan, ilan ang taong nakatutok lamang sa fraud detection and at the same time prosecution of fraud cases?
In
Can we
prosecution,
ask who's your operation head? Ilan all in all, even in the regional offices? Attorney Barbado, if you have any idea.
sorry, Madam Chair, I don't have the number of our personnel.
HR of PhilHealth. Can we
Madam-
ask someone from PhilHealth?
Madam Chair,
Yes,
Attorney
go ahead.
Tolentino po.
Yes, attorney. Go
I'm
ahead.
the head
Legal
po ng
sector ka
legal
din?
sector. Yes,
Okay.
yes, ma'am. Yes, Madam Chair. Actually, yung si Attorney Barbado po is the head of one of the departments under the legal sector dito sa central office. Tama po yung sinabi niya na sa mga regions may mga pro-legal. Sa mga pro-legal natin, we have 117 plantilla positions, 65 casual, and 119 job order. So pang buong Pilipinas po yan, a total of 301. Actually, yung pro-legal, hindi lang po fraud. It's just a part of yung fact-finding na ginagawa nila aside from providing legal service sa mga pro offices natin. Dito po sa
So 301 is lawyers? Number of
Ay, hindi
lawyers
po.
yan? Or yun na nga, ang tanong ko po is ilan ang abogado?
kung sa
Kung sa
regions po
301.
I do not have the exact numbers, pero kung sa regions, per region maximum po ay 2 abogado sa isang regional office. Minsan nga po,
Sir,
All
kung kayo po
regions?
yung head
Sir.
ng opisina, kayo yung general, hindi nyo alam ang ilan ang sundalo nyo, matatalo po kayo sa giyera
hindi
niyan.
po. Yung total number po ng abogado sa mga kasi sa regions po siya, hindi po talaga siya under ng legal sector technically. Anyway, kung ang pagbabasihan po natin ay abogado per region, 1 o 2. Meron pa nga ho kaming mga ilang pro-legal offices na under bar yung
Okay, so clearly, napakakaunti ng 1 or 2 per region. So paano natin aasahan na mapatupad ang isang new and improved TSPC? So palagay ko talagang medyo malabo po yan, di ba? So meron po ba kayong IT-based fraud detection methods? Or lahat po yan manual? Kasi marami na po tayo ngayon na artificial intelligence, etc. ito po bang mga makabagong teknolohiya para sa pag-detect ng fraud, ito po ba ay ginagamit na ng PhilHealth?
If I may,
Yes,
Your
Doc
Honor.
Art. Doc Art.
Yes po, no, noong 2018 po, nag-implement po kami ng MIDAS, Machine Learning Identification and Detection Analytics System. Ginagamit po dito machine learning, no? Kasi since sa amin marami po yung data na pumapasok po sa PhilHealth, nakikita po namin yung mga behaviors and patterns po ng mga ating mga providers, no? So, yung po ginagamitan na po natin ng mga artificial intelligence at saka machine learning for us to be able to detect po yung mga potentially fraudulent claims po. Since 2018
Okay,
po.
so that's good news. So, bakit po 4 lang ang kasong sinampa ninyo? Kung nakagamit na po kayo ng MIDAS, and that's good news, why did that result in only 4 issuances of a TSPC? Sa tingin ninyo, talagang 4 lang talaga ang fraud cases?
Attorney Barbado.
Yes, Madam Chair. Actually, we have around at least 30 issued TSPC, against both hospitals and doctors, Madam Chair.
Magkaiba yung inyong data ha. Kanina
Oo nga,
in the presentation 20.
So, and you think that 30 is the correct number? Because if 30 is the correct number, what's the reason for changing your TSPC? Di ba? Ano yung inaasahan ninyong numero? Palagay ko meron kayong naiisip na hindi yan 4, hindi yan 30, yan ay 2,000. Meron kayong ganun na naiisip di ba? Iyan ba ang dahilan kung bakit tayo nag-new and improved TSPC?
Madam Chair, TSPC is one of the measures lang naman po to protect our funds, so to fight fraud. No? So it is an effective tool for us. The reason, probably the reason why we have a small number of TSPC is because previously we have a our mobility is limited. So we have a very limited opportunity to conduct investigations.
Okay, which brings me to my first point. Aanin mo ang new and improved TSPC kung wala naman tayong A, kapasidad, and 2, pasensya na po credibility. So yun ang dalawa kailangan ng capacity and credibility para magpatupad ng isang TSPC. Siguro huli na lang po, no? So dun, di ba you are a quasi-judicial agency. So ibig sabihin, kung may decisions kayo patungkol sa fraud, pwede kayong i-appeal sa mga regular courts. Tama po?
Yes, Madam Chair.
Okay. Ilan po ang pending cases po ninyo sa regular courts? Patungkol sa fraud, ha?
I'm sorry, Madam Chair, I don't have the number, but we have one in Quezon.
But you have.
Yes,
You
yes,
have.
Madam.
Hindi siya 0. Okay. May tanong ako. Did any court issue any order to temporarily suspend payments pending the cases involving fraud?
I have no information regarding that, but the court has already confirmed our decision to temporarily suspend the accreditation of a particular hospital.
So, galing sa court yan.
It is a decision of the PhilHealth which was appealed by the court, ma'am.
Hindi nga. Ang tinatanong ko sa inyo, kung merong court order, kung merong order mismo galing sa court na nagsasabi, PhilHealth, mag-suspend
Kindly wrap
na.
up.
Opo, ito na po yung last. Kasi basically, Madam Chair, kung wala pong korte na nakapag-issue ng ganyang klaseng order, ang ibig sabihin nun, no courthouse has found sufficient legal basis for doing so. Kasi siguro naiintindihan ng korte na malaking problema kapag nagsususpend ka ng claims payment sa isang hospital na malulumpo ang cash flow ng isang hospital, na hindi mababayaran ang sweldo ng ating frontliners, na hindi mababayaran ang utang ng mga hospital, at magsasara ang hospital, especially now na pandemic, malaking problema. So yun po lamang, Madam Chair. Sana po pag-isipan lalo ng PhilHealth kung ano ba talaga ang layunin dito po sa pag-issue ng TSPC, and at the same time, how wasteful this would be nang hindi tayo nag-i-invest in capacity and credibility building. Yun lang po, Madam Chair.
Thank you, Kong Stella. Papayag ka na ba na 1 peso consultant ng PhilHealth? Pag-isipan nyo na po. Next to interpolate is Kong Ging Swansing.
Thank you, Madam Chair. Can I have 1 hour, Madam Chair?
Yes. Ikaw din, pwede ka rin 1 peso consultant ng PhilHealth. If
Madam
I can
Chair.
recommend.
Grabe ka. Ang tiyaga-tiyaga mo. I really congratulate you and I really admire you. Pareho lang kayo ni Stella. Madam Chair, my first question is, andito pa ba si Secretary Duque?
Yes, ma'am. I'm here listening.
Ayan. So, Secretary Duque, dumaan po ba ito sa board, itong circular, bago lumabas itong circular na to, itong decision nila President Giran?
That is purely a management prerogative, Your Honor.
Okay. Thank you very much, Secretary Duque. My next question is to President Giran. President Giran, ito pong binabago ninyong circular is dated December 2018. So 2 taon na po ito, 18, 19, 20, magta-3 taon na po sa December. Bakit ngayon nyo lang po ito binago?
Attorney Giran?
Thank you, Madam Chair. Actually po, hindi ngayon lang binago. Matagal na po yan. Ang sabi sa amin, doon sa meeting namin, matagal na yung papel na yun ay ginawa ng mga kaukulang rather sector sa aming, sa PhilHealth, sa Pasig office. Kaya lang, tumagal po. May ano yan, may record yan, may chronological record. Tinanong ko yan sa meeting namin. So nagkakataon sa panahon ko na issue. Siguro, I would say siguro na this was primarily triggered by number 1, yung investigasyon sa Senado about yung findings ng kuha, no? And then of course my people would not like to be charged with cases of neglect of duty. So they were just very on their toes, no? Not to defend themselves, to just work what is needed, what is needed of them. And of course there is always that prudence would always dictate that we have to protect our funds.
Okay.
And
So,
of course, there is that balancing effect, of course, of taking into consideration of the concern of our healthcare providers, which are actually our authentic partners. Thank you po.
thank you very much po for recognizing that healthcare facilities and professionals are your partners, no? Kasi po binabasa ko lang po dun sa rationale ninyo, parang hindi po yata dun nakalagay na this is triggered by the investigation in the House of Representatives and Senate, no? Tanong ko lang po sa inyo, Pangulo, did you expect this kind of reaction from the healthcare professionals and healthcare facilities?
Honestly po, I did not expect that kind of reaction, no? And I was informed that in the issuance of that TSPC, there were already matters about the TSPC, only that it was emphasized in this recent TSPC. As a matter of fact, the contents, the essence of that TSPC were already incorporated into pieces before, or rather incorporated into circulars before. So for me, it's basically the job of my people to take care of the funds of the government. No? They have been during my time, they have been investigated about IRM. We have been right now, we have been answering about what we call this exceptions and audit observation from PUA. So these things could be one thing that would be telling the Filipino people that we are doing our job.
Yes.
And for me
Yes,
po,
we understand po.
ako po,
Pangulo,
balansin mo
Pangulo.
ako, ma'am. Balansin mo ako, ma'am.
Yeah. In the
Okay, ma'am.
interest of time po, no? In the interest of time, because kami po ni Chair Helen has to run to Congress, no? Because we have to defend our bills. Ganito lang po. Since partners nyo po sila, as a form of courtesy and taking care of them, hindi po ba pwede na every time you come up with circular, you have to consult them? Kasi napakaganda po nung recommendations ni Doc Almora. President Giran, I am not a doctor. I have friends who has hospitals. Alam po ninyo, hindi naman ako concerned dito, no? Pero nung binasa ko po talaga ito, parang nalungkot po talaga ako in behalf of the health professionals and owners of hospitals, no? So hindi po ba pwede na if you come up with circulars, like for example, what the Department of Agriculture is doing, before they come up with some policies and procedures that affecting the farmers, they consult the farmers. So hindi po ba pwede para po meron kayong harmonious partnership, hindi po ba pwedeng konsultahin natin sila? Do you have that group that coordinates with them?
It has always been my policy that for partners, there should be always, the communication line should be open. And the reason why we have officers in the regions, because these officers would not just be signing document, but to make liaisoning with the healthcare providers. No? And then on issue, ma'am, ito, side issue ito. Yung issue sinabi kanina ni Dr. Almora na yung tinasabi niya na parang lost mistrust, no? Itong sasabihin ko, ma'am. Anyway, I will ask the same question to my people, ma'am. Sabi ko nga, bago lang ako, ma'am, no? But let me say something, ma'am. Na between us and the healthcare institutions are partnership. It is not just an ordinary partnership, Madam Chair, Madam Ging, but it is a partnership that is authentic, a partnership that is based on trust. You can just imagine, Madam, we are the implementer of the healthcare. We are the implementer of the healthcare. What we call this, the
Universal
healthcare
health
program, healthcare program of the government about health of our people, the wellness of our people. And as such, Madam, we have to make sure that the health of our people are well. But Madam, we do not have doctors. I have doctors, but they are policymakers, they are managers, they are scientists, some, but they are not the doctors who will inject, who will prescribe medicine. We have nurses, but they are not the nurses that will assess doctors in the operating room. We don't have hemodialysis machines, and so these services, Madam Chair, are being provided by our partners, the healthcare institutions. How can we accomplish that God-given mandate of this law to provide health care for our people? If there is no trust,
Attorney Garan.
given.
Yeah.
Mr. President, I have a very simple question lang. Sabi ko, hindi po ba pwede na bago po kayo lumabas ng circular or policy, magkaroon po kayo ng konsultasyon dun sa inyong mga partners? Yun lang po ang tanong ko sa inyo.
Okay,
Kasi,
thank you, Madam.
Kongging,
yes po.
yeah, Attorney Garan, in relation po, to simplify the question ni Kongging Den, earlier, sinabi po ni Dr. Almora na walang representative ng healthcare providers or healthcare institutions at the board of directors. Do you have currently? Can you confirm that wala pong representative sa BOD, sa board of directors ang healthcare providers?
Meron po practicing
Sino
kami.
po? Sino po, sir?
Yung ma-express namin si Dr. Grace Gonzaga. We have Dr.
Sir,
We have Dr. Rene Lopez. We have Dr. Galvez.
members po, Sir Attorney Giran, ito po yung members ng Board of Directors. In-endorse
Yes,
po ba sila ng national associations? Kasi meron po tayo doong representative ng sectoral. So meron po doon specifically endorsed and represented dapat yung healthcare professionals. So tama po yun, may doktor po kayo. Pero meron din po ang healthcare institutions. Yon, dapat meron po sila endorsed by the national associations like the Philippine Hospital Association and Private Hospital Association. So I think yun po yung para masagot niyo yung tanong ni Kongging na dapat may consultation kung sana may nakaupo representing this organization, magiging madali yung coordination with the existing organization. Sige, go ahead, sir.
I would honestly, I would presume the rest. I would presume why? Because myself, I was also endorsed by people from the retired officers of the NBI retirees. I was endorsed also for being
Sir, may I cut you short, no? Simple lang po ang aking tanong. Pwede po ba na pag nagkaroon po kayo ng circular at saka policies, konsultahin niyo po yung ating mga healthcare professionals and institutions? Yun lang po, yes or no?
Dapat, pwede siguro maganda siguro.
Maganda po yun.
Mhm.
Napakaganda po dahil instead po na may damage na, bago ninyo sila kinukonsulta. Napakaganda po ng mga recommendations kanina ni Dr. Almora. So parang it's too late already. It's already everywhere in social media na gusto na nila na parang i-review nila yung kanilang kontrata with PhilHealth, and then there are moves na sinasabi na bahala na kayo kung gusto pa ninyong i-renew. Di po ba? So mas maganda po na sana po ay kukonsultahin ninyo sila.
Very good recommendation.
Okay.
Madam Chair. Madam Chair,
Next.
Attorney.
Attorney Tolentino, yes.
Yes, ma'am. As regards sa question po ni ma'am doon sa representative sa board ng healthcare providers, the corporate secretary messaged us that the incumbent board member is BM Padua, Marlene Padua.
Ano po siya? Baka sinasabi nyo lang na doktor siya pero hindi siya representative ng healthcare institutions and professionals. Baka doktor lang siya. Hindi kaya.
Kongging, baka we can ask Dr. Almora then to confirm kung in-endorse nila. Dr. Almora?
Hindi po. Hindi po namin po in-endorse.
Ayan. So,
Madam
linaw
Chair.
po yan, ha?
Madam Chair, can I just interject?
Yes, Secretary Duque.
The board member Marlene Padua is a retired military nurse appointed by the President to be a member of the board. So maybe a amendment to the law may be timely to show that such representations will need endorsement from the major health associations like hospital association, both public and private, or even PMA.
Secretary
Yes, sir.
Duque, nakalagay po sa Section 13. Nakalagay po doon, endorsed by their national associations of healthcare institution. One of their representatives in 5 sectoral panel is a representative from healthcare providers. Malinaw pong nakalagay doon sa Section 13 of UHC law.
Madam, I agree with you. Ang nakalagay kasi sa batas mga national associations, not limited to PMA or doctors or hospitals, but national association. And it becomes the prerogative of the president to choose from those being endorsed by the healthcare national associations. Yun lang po, ma'am.
So, Sec Duque, sino po ang nag-endorse kay President? Kasi ang alam ko, ang process po, may mag-endorse ng list ng name ng President. And then the President will endorse it to PhilHealth.
Alam mo yun, yung fund.
Excuse me. Yes. Sec Duques, if we may know, sino po ang nag-endorse kay Dr. Padua to the office of the president? Kasi, di ba, that's the process. A certain organization, recognized organization, will endorse it to the office of the president, and the office of the president will select among those endorsed names.
Yes, Madam Chair, you are right, but also the GCG. I think if I'm trying to review, look at the provision, kung yung GCG kasi also has a hand in the shortlisting who will be endorsed to the president.
Okay, so much on that, Secretary Duques. Sige, Kongging, please continue.
Thank you very much, Madam Chair. Thank you very much, Secretary Duque. Another question to President Giran. Are you willing to consider the recommendations of the Philippine Hospital Association?
If it is good for all of us, ma'am, it's a welcome recommendation.
So are you willing to consider? Iba po yung very good na sinasabi ninyo, pero ang gusto ko po is makuha sa inyo if you are willing to accept or to consider.
Very much, ma'am.
Okay, ganito po, Madam Chair, I would like to request the committee if pwede po ba nating to conduct another meeting like this, i-compare po natin yung recommendation ng PHA tapos dun sa action ng PhilHealth. Pwede po ba yun, Madam Chair? Kasi
Yes, Kongging.
napakaganda po nung recommendation na yon. Alam po ninyo, President Giran, kung meron pong representative ang Philippine Hospital Association and Philippine Medical Association or Dental Association, whatever, hindi po sana unfair, no? Kasi babasahin ko lang po, ito pong nag-strike sa akin. Sinamarize ko po ito. You are giving a non-extendable 3 days to the healthcare professionals and institutions, no? Non-extendable 3 days from the receipt of the notice of findings, blah, blah, blah. And if the answer lacks merit or satisfy PhilHealth, then PhilHealth will issue yung TSPC after 30 days. If the President, CEO does not act on the TSPC, then it is deemed approved. This is so unfair. Kasi binibigyan lang ninyo ang hospitals and the professionals to answer in non-extendable 3 days, pero kayo, pag hindi ninyo inaksyonan ng 30 days, it's deemed approved. Kaya si VP or RVP will already issue TSPC to the HCI or HCP. It's really unfair. What do you think?
Attorney Giran?
Madam Chair, ang pagkaalam ko po niyan sa discussion namin na yung 3 days is not that new, it's not that unusual. Kahit sa procedure, no? Civil procedure, yung mga 3 days like sa TRO, the hearing within 72 days, 3 days notice, it's already it's there, no? And then the point being is as long as the requirement of the due process is there, it would not be that unfair. Basically, the requirement of due process is in yung sinasabi sa yung nakaraan, yung mga matatandang please before you hit me, please listen. Yun lang ibig sabihin po.
So pwede po ba bawasan yung 30 days ninyo? Kasi kayo, pag hindi kayo nag-action ng 30 days, di ba? O di, gawin na rin natin 3 days yung sa inyo. Kung sinasabi po ninyo na this is normal. What do you think, President?
We will be going back, Madam Chair, to the drawing board for that suggestion. Maganda po. You're giving us idea.
Okay,
I cannot hear you,
Tongjing.
ma'am. I cannot hear you, ma'am.
Sorry.
Tongjing, you're
Okay.
on mute. Last question, please.
Opo.
Ma'am, I
This is
cannot
very-
hear you, ma'am.
Ah,
I cannot
Go
hear
ahead,
you,
go
ma'am.
ahead. Go
Okay.
ahead.
Dito po sa guidelines, no, sa letter Roman numeral 5 of the 2021-0013. Ang nakalagay po dito, yung TSPC ninyo is 120 days. Pagkatapos, meron pang extension of 90 days. Tama po ba yung pagkaintindi ko?
With your respect, Madam Chair, I'll refer you to the author or the proponent of that circular, Dr. David or our legal. Thank you po.
Gusto ko kayo ang kayo ang sasagot eh. Pwede po ba yon, Pangulo? Kasi meron po akong commitment na kukunin sa inyo. Sir, did you get me po?
Come again, ma'am.
Ang nakalagay po dito, ang expiration ng TSPC ay 120 days. Tapos pwede pa siya ma-extend up to 90 days. Tama po ba ang pagkaintindi ko?
Again, ma'am, I'll refer you to the author of that, ma'am, so that I will be guided accordingly, so that I will decide based on the information. Please.
O, sige na nga.
Yes, Madam Chair, may be allowed to speak.
Attorney
tama-
Barbado.
Tama po yung pagkaintindi ko. Hindi, simple lang po. Yes or no lang. Tama po ba yung pagkaintindi ko? Ang expiration is 120 days and it can be extended to 90 days.
If necessary, Madam Chair, it can be extended.
Yes. Okay. So 190 days, 90 days plus 120 days, 210 days. Pwede.
Yes, Madam
Yes.
Chair.
Okay. What happens if in one way or another the investigation is done in 45 days? Hihintayin nyo yung TSPC na mag-expire ng 120 days?
No, Madam. Madam Chair, we can immediately make a recommendation to lift the suspension because there is no evidence of fraud.
Okay. So, basahin mo yung letter M mo. Basahin mo yung letter M.
Madam Chair, sorry. But 120 days, Madam Chair, is only a period of suspension. It can be reduced, Madam Chair, if the evidence so warrants.
It is not stated in your circular. Meron ba kayong circular nakalagay doon? Kasi nakalagay doon is 120 days. Very
Yes.
specific.
Yes, Madam Chair, but
Walang nakalagay dito sa any of your circular, even doon sa 2018-0019, wala nakalagay doon na pwede mo siyang hindi hintayin ang 120 days. Basahin mo yung letter M mo, boss.
Madam Chair, if I may, Attorney Santos, Madam Chair.
Attorney Santos, are you connected to PhilHealth?
Yes, Madam Chair, I'm from
Can you
PhilHealth.
cite your position,
I'm
Attorney
the
Ellie?
acting COO, Madam Chair.
Okay, sige, go ahead.
Madam Chair, may I refer our Madam to paragraph L, Madam Chair, of the said circular. Paragraph L, Madam Chair. Just to answer the question, Madam Chair. May I read, Madam Chair?
Go ahead, go ahead.
The TSPC order may be lifted either by reason of the expiration of the 120 calendar day effectivity period, unless otherwise extended, or when, after investigation, no evidence of an offense was found that the concerned HCP has committed. Because of this provision, Madam Chair, the order of TSPC may be lifted even before the expiration of the 120-day period, Madam Chair. Thank you, Madam Chair.
So, yun ang ibig mo sabihin.
Yes, Madam Chair.
Or when after investigation of an offense was found that the concern. Pwede ba natin, can I suggest for an amendment, boss?
Madam Chair, yes, Madam Chair. As our beloved PCO has stated a while ago, we consider amendment to this, Madam Chair.
Okay, can you add whichever comes first?
Yes, certainly, Madam Chair.
Para clear, no, na hindi natin hintayin yung 120 days bago ito. Okay, meron lang ako last Madam Chair, last na talaga. Doon sa presentation ninyo, no, na nakakalito nga, meron nagsasabi 30, yung na-issuehan ninyo ng TSPC, merong 20, tapos nakalagay doon 9,496 yung accredited institutions, no? Tapos 0.21% lang ang na-issuehan ninyo ng TSPC. So, ang tanong dito is it because hindi ninyo nakikita, yung effort ninyo, effort is there, no? Pero you don't have sufficient people who will do it, kaya 0.21% lang ang na-issue ninyo na TSPC. Kasi ang tinatanong ko lang dito, 0.21% is very small of the 9,496 na institutions. So, bakit nagdala ito ng alarm dun sa ating mga owners of hospitals and ang ating mga healthcare professionals? 0.21% is very small. Are you expecting na marami kayong mai-issuehan ng TSPC kaya na-alarma ang PHA and the health professionals?
Madam Chair, Attorney
Chair,
Tolentino.
Attorney Tolentino.
Yes, Madam Chair. Actually, if I may respond, no. Tama po, pareho. Siguro, well, it's really apparent that our fact-finding, investigation, and enforcement department, as well as our pro-legal offices, lack the necessary capacity in terms of manpower, siguro. And maybe makakatulong din yung IT namin kung for fraud detection. Pwede rin pong i-attribute na hindi naman po talaga ganun karami siguro yung mga nananamantala na mga healthcare providers natin. Talagang makikita po natin dito, itong TSPC, talagang ano lang to, yung parang provisional remedy na talagang pag kailangan lang talaga. Doon lang naman irerekomenda bago i-issue. So, makikita po yan ng ating fact-finding, yung mga investigador natin, pag sobrang talaga, yung pandadaya, makikita naman po yan, meron, kung makikita nyo yung mga reports, bago po mag-come up with any recommendation such as issuance of a TSPC order, marami pong pagdadaanan yan. Kaya hindi ho dapat mag-alala kung wala naman po talagang ginagawang fraud ang isang healthcare provider. Talagang extraordinary ho to. Talagang, at ang pinipigil po nito, ang gusto nitong mapigilan, yung nakita na ho, na very apparent, very convincing na talaga na nandadaya ang isang healthcare provider under investigation, tuloy-tuloy pa rin ang pagbayad ng kanyang benepisyo, lalo na pag napakalalaki at sobrang dami. Kaya ho, parang magtataka ho talagang yung mga investigador, bakit kailangan pang ituloy-tuloy ang bayad kung nakikita na natin na dinadaya tayo. At sa ngayon ho, yung bagong circular, ino-notify pa nga ho namin sila ngayon eh. Before kasi, i-issue na kagad yung TSPC order. Tsaka i-evaluate yung claims.
Attorney
Tapos
Tolentino, ibig ninyo sabihin hindi pa ninyo ito na-issue?
Ito pong circular? Ma'am, na-publish na po siya.
Na-publish na pala eh. Pero Madam Chair, since napakaganda ng reaction ni Attorney Tolentino, na parang extraordinary, pero to the Philippine to the medical health to the healthcare institutions, parang it causes an alarm. And because of this, Madam Chair, I don't think that this is the right time. This is not the right time to come up with a circular, and therefore I would like to suggest, if my colleagues will agree to suspend this circular. I so move, Madam Chair.
Second.
Oh, okay. There's Comsec. Before I act on the motion of Congging.
It's pandemic, Madam Chair. Alam mo, pag marami ang mga hospitals that will close, Diyos ko, Madam Chair, ano ang mangyayari sa Filipino, sa mga tao, sa mga constituents natin, sa buong Pilipinas? Madam Chair, this is not the right time to come up with a circular. Ang laki ng frustrations at naramdaman ko talaga yung sama ng loob ni Dr. Almora, Madam Chair. We have to act on this, Madam Chair.
Congging, if it is okay with you, if I can act later on your motion, we're just checking with our committee secretariat on the policy, because this is a briefing and we don't have a resolution as a basis. What I'm thinking actually,
do you want me to make a motu proprio motion? Sige, I'm okay, Madam Chair. Pwede naman na motu proprio. We're doing this in the ways and means, magbo-motu proprio, and then parang gawin na natin siyang investigation. Kasi Madam Chair, this is not really the right time to do it.
If you can do the motion, Congging.
Madam Chair, I move that a motu proprio motion that this circular 2021-0013 be suspended. I so move, Madam Chair.
I second.
Okay, there's a motion that this circular on PhilHealth 2021-001 be suspended as part of the motu proprio hearing on the matters. Duly seconded. Is there any objection? Hearing none, the motion is approved. Okay, but we can still continue on discussing the details of this circular and all other issues within PhilHealth. Are you done, Congging?
Yes, Madam Chair. Thank you very much.
Before I move on to the next interpellator, I would like to a follow-up question to the previous question of Congging. So in this circular, the TSPC order shall not exceed 120 days unless otherwise extended to warrant further investigation, which shall not exceed 90 calendar days, which has a total of how many days? So 120, tama ba ako, Attorney Tolentino? 120 plus 90 days is 210 days. That is equivalent to 7 months. Tama, Attorney Tolentino?
Yes, Mr. Chair. Yes, Madam Chair. The computation.
Okay, 7 months. But the law, National Health Insurance Act, provides that suspension shall not exceed 6 months without extension. So ang tanong, why does the temporary suspension order have to be longer than what is the law prescribed or provided? Ano po ang basehan ng plus 1 month? Ano po ang naging basehan ng PhilHealth?
Yes, Madam Chair, I would like to call on Attorney Barbado, the co-proponents of the
Okay, Attorney Barbado, you are recognized. This is in relation to the question earlier by Congging Swansing.
Yes, Madam Chair. Actually, the suspension is mentioned in the law, I think referring to accreditation. The TSPC only is a preventive measure, Madam Chair. It does not suspend the accreditation of the hospital. It only suspends the processing of a particular set of claims, Madam Chair.
Guguluhan pa rin ako sa mga explanation ninyo, Attorney Barbado. Wala tayong meeting of the minds, alam mo? Hindi tayo magkaintindihan, no? Kasi malinaw doon sa sinabi ninyo doon sa circular, TSPC. So, ang TSPC is not a suspension of accreditation?
Yes, Madam Chair. It is only a suspension of the processing of particular claims, subject of investigation.
Okay. So, yung 6 months provided in the law is suspension of accreditation.
Yes, Madam Chair.
Present ko to kanina. Yung reference ko is letter C. Yung subject to the respondent's right to due process to suspend, temporarily, revoke permanently, or restore accreditation of a healthcare provider or right to benefits of a member and or impose fines. The decision shall immediately be an executory, even pending appeal, when the public interest so requires, and as may be provided for in the implementing rules and regulation. Suspension of accreditation shall not exceed 6 months. Suspension of the rights of members shall not exceed to 6 months. Ayun, nakalagay po doon, even the rights to yung benefit payments is also a right. So,
Madam Chair, if I may, Attorney Santos, Madam Chair.
okay, Attorney Ellie.
Madam Chair, what you're referring to is the penalty. If the law provides for a penalty of not more than suspension of not more than 6 months, meaning, Madam Chair, for 6 months, the healthcare provider cannot accept, will not accept, and should not accept PhilHealth patients. While under the TSPC, Madam Chair, it only pertains to the processing of claims, Madam Chair, for 120 days, meaning the hospital, the provider can still accept PhilHealth patients if after or even before the 120 days lapses, Madam Chair, the claims will be processed depending on the findings of the investigation. So the TSPC, Madam Chair, does not pertain to the accreditation, meaning the hospital can still accept PhilHealth patients and serve the public, Madam Chair. Thank you, Madam Chair.
Okay. Kasi attorney, if this is not your basis, no, then you don't have the basis in law to impose the TSPC.
Madam Chair, the basis as presented a while ago by Dr. Lambert David was the IRR, Madam Chair. And may I request, Madam Chair, a comment from Dr. Lambert David, Madam Chair.
Madam Chair, may I interject?
Yes, Kongging.
Yung hindi pagbayad ng PhilHealth ng claims, ano tawag mo doon? Hindi ba penalty yun? Sila lang nagsasabing hindi penalty yun. Alam mo, ewan ko lang ha, hindi tayo abogado pareho, doktor ka. Pero alam mo, pag hindi ka binayaran dun sa claims na ikaw, pautang mo yun sa kanila, ano tawag dun?
So,
diba dapat nga ospital pa nga yung magbigay ng penalty sa kanila eh.
Okay, sige.
Ang dami nilang pera eh.
Okay, sige. Next to interpolate is Kong Rep. June Gato.
Thank you, Madam Chair. Gutom na tayo lahat. Madam Chair.
Please proceed, Kong June.